Using different phone systems and devices to manage your practice is a headache. Open Phone makes it simple with a single app that brings your business calls, texts, and contacts into a single place across all your devices. Activate your 7-day free trial and get 20% off your first 6 months when you sign up at openphone.com/Joe. Again, that's openphone.com/Joe. This is the Practice of the Practice podcast with Joe Sanok, session number 1046. I'm Joe Sanok, your host, and welcome to the Practice of the Practice podcast. We are doing this show 7 days a week to help you build a thriving practice you absolutely love. We have so much content, so many sponsors. It's just blowing up. So we are so excited to be here now 7 days a week. Just a year ago, we were just 2 days a week, which felt like a lot. But I just get to hang out with people. I remember my third grade report card, I think probably my second grade and fourth grade report cards all said, Joey talks to his neighbor too much. And now I get to get paid for hanging out with people and just being inquisitive. So I'm really excited about Karden Rabin, who is a nervous system medicine practitioner and an expert in the fields of trauma and psychological disorders. Over the last 15 years, he has combined principles of body work, brain retraining, and somatic trauma therapies, and helped thousands of clients across the globe heal from chronic pain and illness. And he's led programming for the Wounded Warrior Project, yoga centers, and Starbucks. So welcome to the Practice of the Practice podcast.
Thank you for having me, Joe.
Yeah, I'm really excited about this because we can talk private practice, we can talk kind of your clinical skills, and I think that it really is just a lens and a layer that is so beneficial for clinicians of all sorts to think through. So I want to start with, before we started rolling, we were talking about how you used to be a massage therapist, you were learning all sorts of things about the body, but yet your body was hurting more. So take us back to that phase of life and how then you pivoted into something different.
Yeah, I loved and still love body work, all things body, all things functional movement. And for the first really 2/3 of my career, I like to say that I kind of worshiped at the throne of, if I could just get the body in the right alignment, get the muscles that needed strengthening, strengthen, the muscles that needed releasing, and get a person moving, quote unquote, well, that they would be out of pain and they'd be functioning fine. And a lot of the times that worked. And I built a very successful practice around being known as, the quote unquote fixer. But other times it didn't work, right? Despite doing all the things I was taught in terms of body work and functional movement, it didn't achieve the results that I was hoping for my clients. And then kind of the more shameful secret was that year after year after year of my private practice, despite becoming a more skilled and knowledgeable and seasoned body worker, my own low back pain was getting worse and worse and worse. And I largely got into this work originally because I was really obsessed with root level issues, like getting to the bottom of what was causing someone suffering. And I thought I had found it. But it turns out that, again, because it wasn't working for others all the time and it wasn't working for me all the time, and that I was missing something. And what I ended up learning was how trauma, chronic stress, and peculiarities of the way our brain works, especially the way it can sort of scramble the circuitry of emotional pain and physical pain, that there was a deeper thing going on here. There was a software level thing, not a hardware level thing, a software level thing going on in people's mind and bodies between their brain and pain that was driving these chronic cycles of pain that the other methods were not improving. And so when these methods of using brain retraining, of using emotional processing, of using somatic experiencing and other really bottom up nervous system level practices they finally eliminated my pain, really just on the eve of me considering getting surgery. And so that's how my transition from sort of advanced body worker into nervous system medicine practitioner happened.
Oh man, we have a lot in common. When I was actually 19, I had had a really bad snowboarding fall my freshman year of college and herniated 3 discs. And through that process, they found out I had a spinal stenosis. And then I went through all of these like steroid treatments. And eventually, the Mayo Clinic did surgery and said it like was one of the worst backs they had seen in someone my age. So I had the hardware issue first, but then I think that that whole software issue thing. I love how you framed that because when I'm stressed out, I have flare-ups with my back, and I know it has nothing to do with that original injury. Or if I do find myself that I'm not walking as much as I normally do, that sometimes flares it up. But that whole like psychology side of pain, I would love for you to just more for my own personal interest, like dig into that. What are some ways that that manifests for you, and what were some of the solutions that worked for you in addressing that, as you call it, software problem?
Yeah. So Joe, your story is a perfect example. And one, I'm really glad that you got the help you needed, that you fixed the hardware, and that you're back on track. But I think the easiest way to understand this for you, for your listeners, for myself, is when you have an actual injury like you had, as well as stress and fear, it creates conditioned associations and responses in your nervous system. Karden, what the hell does that mean? If you have ever had food poisoning from, let's say, um, any kind of ethnic food, whether it be Mexican, Indian, you name it, and you have one of those awful, awful, awful evenings, Joe, what happens the next time you smell that cuisine?
Oh, my sister once puked on orange juice when she was a child, probably because she had just a stomach issue, and she will not drink orange juice. So you feel nauseous. You feel like you can't eat that food.
Correct. So after you've had essentially a traumatic incident from a food situation like that, your nervous system, the next time it smells it, even though the likelihood of that food being dangerous or contaminated or whatever is super low, you just smell it and your body deploys a range of aggressive, true blue biological reactions, including nausea. Someone might throw up. They might get pale. They might start to sweat. They might need to leave the space. So there's a perfect example of basically a stimulus in the environment that reminds your nervous system of a previously highly stressful and dangerous experience where it deploys pain and other forms of dis-ease in your body to protect you. Guys, the exact same thing happens when it comes to recurring chronic pain, right? Joe, you had an injury, something scary happened, it took a long time to quote unquote fix, right? And then even after it's been repaired, the software, the nervous system, it does not necessarily get updated. It does not necessarily know like you know. Your autonomic nervous system does not know like your conscious nervous system that that's safe and fixed. And so then one, stress alone can cause those neural pathways that were previously conditioned to fire off. And then specific activities that may have been painful before it was fixed, before the surgery, like, I don't know, starting up a lawnmower, lifting one of your kids. The brain will associate that still with danger, even though the biological reality of the tissue is no longer that way. And it will create a full blown pain response. It'll even, quote, make your back go out, all because it's initiating uh, essentially a misappropriate protective response.
Mm. So when you recognize that's happening, what are some of the techniques that you discovered or that you think can help retrain the brain to not go into that automatic reaction?
Yeah, so there's a variety. The grandfather of this work, which was a physician named John Sarno, really one of the first lines of improvement, because your mind is connected to your brain, which is connected to your body, go figure. is that when you become educated in the psychology and neurology of pain, that alone creates an amazing improvement in de-fearing, bringing the fear out of your mind and body. When you firmly know, oh my God, there is nothing wrong with my hip. My hip is just fine. And this is my nervous system actually making a mistake in predicting pain. For many people, that alone starts creating physical pain symptom improvements. And especially when they feel the pain during action and they can remember and literally kind of pause and speak to their own mind body and say, there's nothing wrong. We can continue this action, and they do the action without fear and stress, even maybe in the presence of the pain. That starts to undo the conditioning in the nervous system. It's kind of like when you hop back on the horse after you've fallen off, you're teaching your mind and body that it's not dangerous. That's one of the first lines of defense that you can do. In fact, one of the things that I used to do is when my low back pain would flare up because of nervous system reasons, I would take a deep breath. I'd remind my body that nothing was wrong. And then I would go deadlift. I would literally go to my gym and start lifting weights to demonstrate to my body that there was no pain. That there was no damage and that we were fine. So those are so that's second method. Don't go right into deadlifting, folks, but it's called graded exposure, where knowing that there's no actual tissue damage and you're trying to reprogram your brain and movement, you deliberately do the movement consciously to teach your body that it's safe again. Those are just two first line methods that we use.
I love that idea of going right into deadlifting. I think that's such a smart way to just teach your brain, like, no, this is not as much of a problem as you think.
Joe, I'm sorry, Joe, you made me think of one more nerdy thing, which is
yeah, do it, jump in.
The other thing about this, speaking of deadlifting, is if you start to, and I apologize to every body worker and every functional movement person who's listening right now, but if you actually start looking critically at people's pain patterns associated with the movement and the activities that they do, it's all freaking bullshit. And especially in chronic pain patterns. And so what I mean by that is, like, someone will say, oh, my back kills me when I'm in the car driving to work, but it doesn't bother them when they are exercising, right? Or it always gets me when I'm lifting up my kids, but funny, it doesn't happen to me when I'm like mopping the floors and doing the laundry. It happens in the morning, not in the evening. When you start really looking critically at something, like if someone has a seriously arthritic knee, quote, and actually, like, let's say we're blaming arthritis or tendonitis, whatever you want to blame, that pain should not decide randomly when it is and isn't painful. And when you're trying to justify that random presentation with some kind of biomechanical explanation, I'm sorry, it's usually bogus in chronic pain patterns. When you start looking at it from stress or conditioned responses about why that pain is presenting at certain times and not, that becomes much more clear. And so that's also part of the healing process. When your mind can look at your own body and be like, yeah, it makes no sense that my low back pain hurts when I'm standing at the bar, but it doesn't hurt when I'm lunging and squatting. That really starts to help you rewire your brain's pain responses.
Now, I want to dig into kind of you starting the private practice. So that was sort of the way that you got into doing functional medicine. I do want to hear more about kind of the nervous system and all of that. But as you started to make that transition, what did that look like? What was easier or harder than you expected? Just take us through just some of that kind of launching the practice for you.
So when I transitioned, sorry, Joe, I'm apologizing now. Did you mean when I started or when I transitioned?
Maybe as you were transitioning away from the massage therapy into the new specialty and kind of realizing, okay, I'm not going to do as much of the massage. I'm gonna kind of switch a little bit here. What did that look like, and how did that transition go?
That transition, it was mainly positive, and the way I navigated it was I was really excited to try this new work. And essentially, I kind of had three categories of client that I could or couldn't try the work with. So even to this day, after basically being a nervous system medicine practitioner now for 7 years, I still have a handful of legacy massage therapy clients that have been with me for like 14 years. I love them to pieces. I enjoy seeing them. And it feels actually quite nice to just do the body work I've been doing with them forever. And so there was that category of sort of true blue legacy who I liked working with, who I really never even introduced to the new work. And that was one category, and I was fine with that. The second category were pre-existing clients that I knew would be open to the work. And those folks were the first ones I went right in. I just started experimenting with them. And I think, I hope most of you have those clients who are always excited about, like, when you come back from a new professional training or you've learned some new skills, they're the ones who want to progress with you. And so I started doing the new style of work with them to wonderful results. It was also a really safe way for me to practice because these were clients that had a lot of trust and rapport with me, and that built up my confidence. And then there was the third category, which were new clients coming in the door. And for the first year or two, I made a judgment call during the intake about whether or not they were going to get Karden 1.0 or Karden 2.0, right? Karden the body worker or Karden the nervous system medicine practitioner. And so it really was almost 2 to 3 years of that transition. But towards, 2 to 3 years in, I followed my passion, and I really no longer wanted to work with people who were expecting a body work solution. I wanted to work with people who wanted the psychophysiological, the nervous system solution. And it very naturally came, I think, because I wasn't sharing myself like this anymore. I wasn't working necessarily with the same colleagues, that the influx of people who are coming to Karden the bodywork guy wizard switched to Karden the nervous system guy wizard.
Mm. Yeah, I love that. And I love that idea of clients coming along with you. I think that so often, as people change their specialties, they're worried they're going to lose people. But the reality is there are people that want to grow and change with you. I remember when I was going through the Gottman level 1 and 2 couples work, there was a high school young man that I was working with, and it was clear that he was kind of graduating from therapy, and the initial issues he came in with were more around kind of parenting, and that his parents were having some issues, and to even just see how they wanted to transition in. And I said, hey, there's this assessment that I'm learning about, would you guys do it? And they gave great feedback around what worked, what didn't work, because they knew I'm transitioning into kind of this deeper couples work. What was harder than maybe you expected as you made some of those transitions?
I think what was harder than expected is I, like a lot of folks who get into this work, I have people pleasing tendencies, and I have conflict avoidant tendencies, which really means I will do almost anything in my power, forget conflict, to just get someone not to be upset with me. And I really had to start doing inner work to transform the parts of myself that were essentially terrified of disappointing people, and which were therefore inhibiting my ability to grow, change, and actually help people on a much bigger level. So in transitioning into nervous system medicine, not only am I helping people resolve their chronic pain and chronic conditions like fibromyalgia, chronic fatigue syndrome, mast cell activation syndrome, IBS issues, because they're all related to the nervous system. It's impossible to do that work without also doing a lot of inner work in a trauma context, in an attachment style context, in a developmental context, in dealing with your own emotional wounds. So the hardest part was actually working with my own fears, my own avoidance tactics, my own coping mechanisms. And although that was the hardest part, it was the greatest form of growth. It was my growth edge. And in being able to both compassionately work with, but powerfully kind of transform and overcome those limiting aspects of myself, I've been able to ascend my practice and my impact to levels that would never have been possible before then.
Do you often find yourself overwhelmed by the influx of client calls you receive? Receptionists are expensive, but you can't afford to let your patients go to voicemail. You care for your clients, so you try to phone them back, but more often than not, it's too late. They've gone to another practice. When you partner with Well Received, you capture every opportunity. Your calls are answered by professional medical receptionists 24/7, and they can support you with more than just message taking. They offer new patient intake, after-hours service, bilingual services, medical appointment scheduling, medical live chat, and so much more. All this at a fraction of the cost of an in-house receptionist. Your patients are Well Received's priority. As a Practice of the Practice listener, you can get an exclusive 50% off your first 2 months of service. Head on over to wellreceived.com/Joe to start growing your practice today. Now, maybe we should have started here, but I kind of like following the journey. Now, take us through, some of the practice that you're doing where you're combining principles of body work, brain retraining, somatic trauma therapies, nervous system. Like, we have, thousands of therapists listening to this that are doing all sorts of work. I would love to just start with, in those specialty areas where you're at, like, what do you wish every therapist that's practicing just knew, understood, had radars up for, things that they could then help with just with limited training, and then things that maybe they should have antennas up for referring out?
Yeah. So, what I want everyone to know, regardless of what practice you're in, from psychotherapist to body worker to personal trainer to dentist, is that whenever you're working with a client, whether you know it or not, you are in an active conversation with that person's nervous system, consciously and unconsciously, all the time, no matter what you're doing or not doing. And the conversation between nervous systems is nuanced, but at their heart, every time, is on the spectrum from safety to danger, period. And what you might have seen some of this research before, that basically clinical skills being equal, bedside manner and rapport between client and practitioner consistently and statistically leads to robust superior outcomes than when that's absent. And what is that? Well, it's explained perfectly when you think about a human being from the brain and nervous system's perspective between safety and threat. When a nervous system feels like it's safe, when it feels like it's actively connected and being compassionately cared for and seen by whatever practitioner is working with them on whatever topic, they will intrinsically have better responses because all of our neurophysiology works better, especially our healing capacities, when we are having an experience of safety. And so I actually look back on my career as a body worker, and often when I made the biggest differences with clients, it wasn't because I used the best technique or I used some wonderful fascial, hack or some neuromuscular technique. It's because without realizing it from when I started in this career, not only was my, my soul or myself, but my hands themselves were always cherishing and holding the connection between myself and my client with the utmost care and love. And sometimes when I didn't know what to do for a tight part of someone's body, I would just hold it between my hands and do nothing, but almost as if my hands had speakers on them, send a message of like, I'm here and it's okay. So that's the
Mm.
message that I'd send, Joe, to every single person listening. If you can add that to your um, to the foundation of how you work with people, you'll get revolutionary results.
Mm. Now, what are things that you think people should be looking for if they're thinking about referring out? What are things that clients might say, or things that the average clinician would just miss if they hadn't listened to this podcast or didn't really dig into some of this work?
Hmm. I think that it's so unique and individual, but I would say this, that I would, as a in terms of red flags, I'm not sure about red flags, but what I'd say is I'd look for deficits in their care team. So if someone is regularly going, let's say, to psychotherapy, um, and they're doing the best they can take care of their mental health, but they're not tending to their body in any way. They're not going to body work. They're not going to cranial sacral. They're not tending to what's below the brain. That's a big black hole. That's a missing piece that needs to be woven in. Similarly, if someone's doing body work and fitness and yoga and they're really taking care of the temple below the head, but they are not doing the deeper introspective and reflective work that psychotherapy or trauma work is capable of doing, um, you're going to hit a glass ceiling if the emphasis is only on one side or the other. So that would be something that I would look for in referring out. And I think the other big thing of referring out is I always generously referred out. And why was that? Ultimately, I was committed to the success of my clients and them getting the outcome they needed. And so me referring out was never a reflection of my failure. It was a reflection that the skills that I had were insufficient in and of themselves to take care of this person in their entirety. And therefore, by referring out and them especially having success with that referral, the amount of kind of appreciation, gratitude, and I'd say just affection that I got from those clients was as much or greater than the clients that I helped themselves. It's kind of like an alley oop, right? I might not have sunk the basket, but I threw the pass that helped make that happen. And so, that point is mine too. So I would say that refer out more often. Don't view it as a reflection of yourself. And you really should refer out if you're feeling yourself insecure or anxious about being able to help a client. Because like the moment you're disempowered, you're going to have a lot of difficulty helping someone.
Mm. So true. Well, the last question I always ask is if every private practitioner in the world were listening right now, what would you want them to know? And I know you hit on some of that, but what else would you want them to know?
This is the Practice of the Practice podcast. And so in addition to sort of the, I guess, more therapeutic things we've been talking about up until now, I think on the more pragmatic or even business side of things, I like to say that there is an ocean of people that need help. There is a pond of people that can help, and a puddle of people who are any good at all. And we need to do a better job. All of us need to do a better job of sharing our work with the world and find and helping the people that need our help find us and how to help ourselves find them. And so if you're playing it shy with what you're up to, if you're playing it shy about your talents, if you're playing this whole game of like, I don't want to pressure people or I don't want to whatever, I really invite you to do some inner work around that. And, you should always have a little, you don't want to just be out there, saying you got to do this sort of thing. But if you're feeling you have like your own limitations, your own inner blockages, if you feel that like when you're about to share what you do with someone and then you kind of shrink and you don't do it, I invite you to do the inner work to move past that, because you're depriving the world of your gifts as long as those limitations are in place. You are depriving people who want and need your help of having that help. if you're not addressing those internal blockages. And that's what I'd say. Don't let your own limiting beliefs and coping mechanisms and smallness stop you from helping people.
So awesome. If people want to connect with you, if they want to follow your work, where should we send them?
Yeah, there's a couple of places. So the best place is on Instagram, at Karden Rabin. Also, my company is called Somia International, and we're at Somia International on Instagram or somiainternational.com. And I think that another really great place to go is my partner, Jennifer Mann, and I. We just published with HarperCollins our book, The Secret Language of Your Body. Regulate your nervous system, heal your body, and free your mind. And that book, if you're interested in some of the topics that we talked about today, will immerse you in your nervous system, immerse you in seeing how certain conditions in your brain and nervous system are either causing your own suffering, causing some of the limitations you and I just spoke about, Joe. And it's also going to beautifully expand your mind, no matter what practice or area you're in, on how bringing in elements of the nervous system can really transform not only yourself, but how you're working with your clients.
So awesome. Well, thank you so much for being on the Practice of the Practice podcast.
My pleasure, Joe. Thank you.
I always love interviewing people outside of the typical counseling space, especially those that are practitioners and clinicians in different ways, because sometimes we can get siloed in the way that we think about things or what we think is normal, but we can get some great ideas outside of it. I forget what book it was. I want to say maybe it was one of the Malcolm Gladwell books, where he was talking about how this ER found that they were having the biggest problems, the biggest mistakes during the handoffs between like the ER surgery into like the room, and then from the room going from a less intense care area. And the ER kind of main doctors went and trained with sort of like a NASCAR pit crew to see how they did the handoffs. And they learned all these really interesting things by going somewhere else and thinking differently. And so I think it's so important to not just get stuck in our silos. Apple was famous for sending top people to go to really expensive hotels to see how they did their trainings around service desks. And that's where, the Genius Bar came from. And so when we look in other areas, we can often pull out really kind of good and interesting ways of doing our own work. Also, the more that you can automate what you're doing, the more you can do the work you actually love. I don't know about you, but I don't like doing kind of intake phone calls. When I had my counseling practice, doing all the intakes, I would miss new potential clients. Having a team that can answer for you, answer your questions, just puts your money and time at work in a much different way. Well Received is our sponsor today. They are a 24/7 medical receptionist service. It's what I wish that I had had back when I owned mental wellness counseling. They also have English and Spanish. They do appointment scheduling, new patient intakes. You're going to make a great impression right from that very first hello. And also you can get 50% off your first 2 months. All you have to do is head on over to wellreceived.com/Joe. Again, that's wellreceived.com/Joe. Thank you so much for letting me into your ears and into your brain. Have a great day. I'll talk to you soon. Special thanks to the band Silence is Sexy for that intro music, and this podcast is designed to provide accurate and authoritative information in regard to the subject matter covered. It is given with the understanding that neither the host, the producers, the publishers, or guests are rendering legal, accounting, clinical, or other professional information. If you want a professional, you should find one.